Hi, my name is Sandy. I'm a technician out here at Grady's Veterinarian Hospital. Today we'll be talking about subcutaneous fluids or sub-Q fluids. We do sub-Q fluids for multiple reasons. Today we have Boeuf. He is a kidney failure renal patient. I'll be getting him out and introducing him to us and giving him subcutaneous fluids. Boeuf comes in, he receives fluids about once a day. The owner has learned to do fluids at home and has become very good at it. And Boeuf's very comfortable. But for training purposes, he's here today and we'll be using him. Sub-Q fluids are just that, subcutaneous fluids up under the skin. So we'll put them under the skin, and throughout the day they'll rehydrate our patients. We give them for many reasons. If a patient comes in and has had some vomiting and diarrhea and maybe running a low-grade fever, we would suggest sub-Q fluids to rehydrate them, to make them feel a little better, less nauseous. So today I'm going to demonstrate how to put a bag together. Our clients do, if we do IV fluids or subcutaneous fluids in hospital, the clients usually bring the bag back and forth to us. And we hook up the IV line to the IV bag. So this is the IV bag of lactated ringers. It's just a bag full of nutrients, fluids, and rehydrations. We pull the tab off. And most of your clinics will put these together for your clients, so don't get concerned. But for demonstration purposes, we're going to start at the beginning so everyone understands. Everything is sterile, so we would like to keep it that way. We took the tip off. We'll be injecting into the hole, turning the bag upside down, squeezing the line. Then we have a turn off and turn on switch. Right now we'll turn it off. We have an IV pole that we use here. Now don't panic because we realize most clients don't have an IV pole at home. Let gravity be your friend. I always suggest a kitchen cabinet with a button or a knob. Hang your bag on that. Have a friend hang your bag. The higher the bag, the faster the fluids. So once we have run the fluid through the line, there is a guard tip on the end. We'll turn it, make sure all the fluids run through the line so there are no air bubbles. Very important to know that each and every time we treat a patient or you do a treatment at home, change your needle. We don't want any infection starting, and a clean needle is always a must. So right now, let's get Boeuf out. We're going to introduce him. He's a wonderful cat. When we have a kidney failure patient come, first thing we always do is ask the client how they're doing at home. Boeuf is doing really well. Boeuf is a very handsome boy. As a kitten, he had some facial trauma, as you can see, and his mouth's a little offset, but he's a wonderful boy. He eats well. So right now we're going to weigh him, make sure that he is holding his weight. And indeed he is. So Boeuf is just relaxed. I think the most important thing when you're doing treatment with any animal is to remain calm. We don't want them excited. Or with any subcutaneous treatment plan, I always say the best way to do it, pull the skin up, make yourself a nice tent. And here we have a nice tent where you can poke in. So then we're going to get ready to give subcutaneous fluids to Boeuf. Now Boeuf does very well with 100 mLs a day. Each line represents 100. So this bag contains 1,000 mLs of fluid. Boeuf only needs 100, so we'll go down to 1 today. So again, we're getting ready to give Boeuf his treatment. We would want to pull the skin up, make a nice tent, and the way you know that is because it's a V. Now, when we're inserting our needles, this is very important. We want to make our tent, get a nice pocket. We always insert straight. We never go down, we never go up. So it would be a nice straight insertion. Let's take our guard off. In we go with the poke. Very nice job. I always hold my line because if an animal would move, I wouldn't want to repoke them. Now, our needle is inserted. We go to our line, we turn it on, and as you see, we start to drip. Now, sometimes you'll see a drip or so come out. I don't want anybody to panic. Just readjust your needle by pulling out a little. As you can see, Boeuf is very comfortable and relaxed throughout this. This is a very good treatment for Boeuf because his kidneys don't need to work as hard when we rehydrate him, and it keeps him healthy and weight bound. So as the fluids are running, we're just about there. As you can see, 100 mL does not take a long time to do. And we're there at his numbers. Oh, thank you, sir. So when I pull the needle out, I'll just put my finger over the hole, because sometimes they will drip a little from their treatment. And you'll see that he has a little bubble. So do expect that if you have an animal that has been treated with subcutaneous fluids, that they'll have some sort of bulge. And again, all of the fluid rates will be determined on the weight and rehydration of the patient. If there's ever any questions, your veterinarian office can answer them, or we as technicians will be more than happy to demonstrate as many times as it takes to do your fluids at home. Thank you very much.